for joining us. Today I have Dr. Patrick Alore, and we're going to be talking about pancreatic cancer. Thank you for joining us.
You're welcome.
What are the signs of pancreatic cancer?
So pancreatic cancer, unfortunately, has very nonspecific signs, meaning the symptoms that pancreatic cancer causes could be caused by a number of things. So abdominal pain, you could probably think of a lot of things that could cause abdominal pain, but that's one of the main symptoms of pancreatic cancer. Back pain, nausea, blood clots, jaundice. Jaundice is yellow of the skin or eyes. Some of these are pretty specific, but most of them, and most of the time, they are very nonspecific.
And at what point does a patient need to call their doctor?
If a patient is experiencing any of those symptoms, they really should seek medical attention, especially if, say, abdominal pain is lasting more than a few hours.
If you're having abdominal pain, I would think that maybe I have something wrong with my, something on the side or some different kind of thing.
Right, and you're probably correct. If you have abdominal pain, it's probably not pancreatic cancer, but if you have something like jaundice and abdominal pain or nausea and blood clots, then putting it all together, the patient should get a study, a CT scan or an MRI of their abdomen, and the doctor reading the CT or MRI needs to be aware that they need to look at the pancreas as well.
Okay. I mean, it sounds like it has to be a combination of the things.
Correct.
Okay. What are the risk factors for the development of pancreatic cancer?
So the risk factors are include smoking, heavy alcohol use, obesity, also family history and genetic factors. Those are the most common. There are some occupational exposures, but they're very rare chemical exposures.
Okay. And then is exercise or lack thereof also a factor?
Well, being overweight does increase your risk. So if you're not exercising, I suppose you might be overweight, then I guess lack of exercise would increase your risk.
Okay, all right. And then you mentioned earlier CT scan or an MRI. So are those the two types of tests that can be used?
Those would be the best types of tests to use in a patient if you're suspecting pancreatic cancer. And again, if you have some symptoms and maybe a family history, you'd want to get an MRI or CT with contrast, utilizing a pancreatic special protocol to look at the pancreas and evaluate for lesions which might be cancer. You wouldn't want to get an ultrasound, for instance, because an ultrasound might not look at the entire pancreas. It could only see parts of the pancreas, and of course you need to see all of it to say whether there's cancer there or not.
Okay. Now, is the contrast, is that what you have to drink? Is that something that's injected?
Right. So in this case, the contrast is something that's injected into your veins and can be thought of as an image enhancer, or some patients call it a dye, even though it's not a dye.
What is it made up of?
Well, it's made up of particles that cause certain lesions in the scan to stand out more than your background organs.
Okay, so kind of like a highlighter.
Kind of like a highlighter. That's a perfect way to think about it.
All right.
Yeah.
And then what is done if the CT or MRI finds something suspicious for pancreatic cancer?
So if something suspicious is found, usually a patient goes right for biopsy to get a piece of the tissue to say if it is cancer, and if it is, what type of cancer is it. Sometimes the CT scan is so suspicious and it might show evidence of metastatic disease or spread of the tumor to other parts of the body, in which case before they do a biopsy they might want to do whole body imaging. So that could be with a CT scan of the chest, abdomen, and pelvis, or a PET CT, which is whole body imaging, utilizing nuclear medicine and CT together.
Is there a specific type of radiologist that would have to read these?
Well, usually a radiologist such as myself, a body imager with some expertise in cancer imaging would be the doctor to read those.
And that's not the first person that we meet when we have our image done, right?
Well, the first person you meet is usually the technologist who takes the images, and then the technologist sends those images to the radiologist for interpretation, and you may, as a patient, never meet the radiologist.
Oh, really?
Right.
Do they work in the same facility of where the image is done or not?
Sometimes they're in the same facility, but a different room, and sometimes they may be further in another center. The more subspecialized or the more special type of radiologist you have, the more of a chance that that doctor is working somewhere else and not at the facility that you're scanned.
Okay. And then in regards to pancreatic cancer, how should somebody find out about it?
Well, usually the radiologist reads the CT or MRI. They create a report, and the report is sent to your ordering doctor, your family doctor, your internal medicine person, your gastroenterologist, and they should sit with you and go over the report with you and tell you if you have this diagnosis and what the next steps in treatment are.
Okay, and then if somebody is it like a history type of thing? If it's in your family, should you be concerned that you can get it?
Yeah, if you have a high family history of pancreatic cancer and you have some long-standing symptoms like back pain, abdominal pain, you should definitely speak to your doctor about your concerns.
Okay, great. Is there anything else that you'd like to share with us?
Not about pancreatic cancer.
Okay, very good. Thank you so much for the time.
Sure.
And remember, if you'd like additional information about what we've just discussed, please visit radnet.com.